Actually, I have a pre-printed bio. I just click and send. I'm with Healthcare Now of Maryland and the Maryland Chapter of Physicians for National Health Program, and I see a lot of familiar faces. So I know that many of you already know what single-payer healthcare is, but for those of you that don't, there's two major components of single-payer healthcare. One, that it creates a health system so that we can start using our healthcare resources on a rational basis and make sure that everybody can get what they need. And two, it gives us the money to pay for comprehensive, lifelong health care for every person living in the state, or if we can pass it at a national level in the nation. And so that's what we're fighting for. I was asked to talk about what is the effect of the militarized economy on our movement. And of course, we all know the costs of the health costs of having a country that prioritizes war. And so many of our vets that have unmet health needs, or as Chris Hedges also says, though, in his book, A War is a Force That Gives Us Meaning, is that we often measure the cost of war in terms of the physical destruction, but there's also the mental and spiritual destruction that goes on for decades or generations in our country. And so the cost of war is very far-reaching. When it comes to healthcare, the truth is that we're already spending enough in this country on healthcare to provide comprehensive, lifelong healthcare to every person. So it's not about the money. And the truth is that that's the really truth about everything, is that we know what the solutions are. We know how to use our dollars in this country wisely to create a society that supports all of us. But the problem is that that's not what the whole game is about right now. The problem is, and someone coined this term, and I think it's so appropriate, it's FOG, it's forces of greed. We're up against the forces of greed. And they pervade our country, and because of them, our political process is broken. And so that's why we can't get the change that we need. It's not about common sense solutions. It's about how do we shift what's going on in this country to overcome the forces of greed, or to clear the fog, and to actually create the society that we want. So underlying that, well, actually, I wanted two things. Wanted to mention a book that I'm reading right now, which is called Griftopia by Matt Taibbi. Have any of you read this? Because the oil prices are not really related to supply and demand. They're more related to what's going on with commodity trading right now. And so it's important for us to kind of know what's really going on. And it kind of outlines as well the decline of our society and the fact that states in America are now starting to sell off public infrastructure to foreign investors. These, what do they call these? They're SWFs and things, sovereign wealth funds. So this is what we need to do right now, I think, and I'm so glad that Jean and others have spearheaded this, because the absolute solution right now is to build a broad-based social and economic justice movement. And I think focusing on the war spending is key, it's paramount, and focusing on the fact that we need to reprioritize and put our spending into our domestic needs. We hope that single payer will be part of that. It's a common sense solution. I was lucky to attend the United National Anti-War Conference last July in Albany, and they put together their statement and included single payer in there. They wrote, "Our love of humanity, opposition to expanding wars and occupations unleashed by the Pentagon, and respect for international human rights and humanitarian law, including the right of self-determination for all peoples, require that we demand of the U.S. government the allocation of the trillions spent on wars and corporate bailouts be directed to funding massive programs for jobs at union wages, education, a single-payer universal healthcare system, child care, housing, and preserving the environment." I think that pretty much says it all. So as far as the single-payer movement, we would love to be included with you. We would like to be part of the solution of what our domestic priorities are defined as. And the three quick things that I wanted to emphasize that I learned through the work that I've been doing the last 4 years, I left practice about 4 years ago to do this full time, is the three things that we need to focus on are have the initials ICU, which in medical terms is intensive care care unit and we say we're in a crisis, we need the ICU. The first one is independence. It's imperative that we build a social movement that's independent of political party. I feel at this point it doesn't matter who we put into office because our process is broken. And so we've got to build an independent movement that pushes whoever is in office to do the right thing. We must be absolutely clear about what it is that we want, and that's why it's so important to be able to spell out exactly what the solutions are that we're looking for. And then we need to be uncompromising. We need to stop settling for crumbs. Just looking at healthcare in the state, we've been settling for little Medicaid expansions here and there, but we've not even been able to keep up with the number of uninsured that we have. The number of uninsured continue to rise. So we've got to demand real solutions to meet our needs as a people. I'll leave it at that. Thanks.